Good morning, everyone. Sorry, be back. Okay, today it's an honor to introduce Dr. Coachman. Dr. Coachman graduated in dental technology in 1995 and in dentistry at the University of Sao Paulo, Brazil in 2002. He's a member of the Brazilian and American Academy of Aesthetic Dentistry. Moreover, Dr. Coachman attended the ceramic specialization program at the Ceramo Art Training Center, where he also became an instructor. In 2004, Dr. Coachman was invited by Dr. Goldstein, Gobber, and Salamat of Team Atlanta to become head ceramist of their laboratory, a position he held for over 4 years. He is the developer of the digital smile design, the pink hybrid implant restoration, the virtual planning center, emotional dentistry, interdisciplinary platform, and the smile donor concepts. Conceptual developer of DSD app and the founder of DSD Digital Smile Design Company. Currently, divided his time between his family dental clinic in Sao Paulo, Brazil, and Digital Smile Design headquarters in Madrid, Spain. He is the director of DSD residency program with continuing education courses for dental professions from all over the world. Also, he works as a consultant for dental companies and offices, developing products, implementing concepts, and marketing strategies. He has lectured and published internationally in the field of aesthetic dentistry, dental photography, oral rehabilitation, dental ceramics, and implants. In 2017, Dr. Coachman became an adjunctive professor of restorative department at University of Pennsylvania School of Dental Medicine. Today, we are very welcome Dr. Coachman.
Good morning, everybody. Great pleasure to be here in Taipei. I would like to thank, of course, Gloria, Rocky, and the whole team for inviting me and giving me the opportunity to share our ideas with our colleagues here in Taiwan. So I also want to thank each one of you for coming over. I know that usually on Sundays we like to relax. So it's really an honor for me to see you all here willing to listen to me and to understand a little bit more about digital smile design, digital dentistry, digital treatment planning, digital team communication. But you see the word digital many times, but I believe that digital is just a tool. In fact, what we want with technology is to facilitate the process of using concepts that are not new. Dentistry, clinically speaking, technically speaking, hasn't changed that much on the last 10, 20 years. So more important than understanding if we're going to use digital or not is to have very solid background on the basics of dentistry, as we all know. So you're going to see that actually the lecture is about how can we take the principles that we all know are the modern principles of oral care and utilize technology to simplify the process of using these principles for the benefit of our patients. Another goal of this lecture is to understand how to bring modern principles to your office to make you look different, look special in the eyes of your patient. How can you make your patient pick you instead of the other dentist? What makes you special in the eyes of somebody that is looking for a dentist? Your possible new client. So the lecture will focus as well on bringing strategies, and more than that, bringing stories that you can tell to your patients to make them understand the value of what you may give them. So it's all about creating value, making people value all your hard work. It's very hard for patients to understand the benefits of what you're bringing, or for them to evaluate the quality of your services. So we need not only to become experts on delivering great dentistry, but we need to become experts on making people understand that we are delivering great dentistry. Make people value everything that we do for them. So we're going to talk about that as well. The concept of DSD, Digital Smile Design, became a methodology, a philosophy of how to find solutions to improve these 4 moments of dental care. When we get new patients, we want to understand first how to start the treatment plan process by creating a better smile design. How can we use technology to facilitate the design process? Then how we can use technology to improve team communication, and through better communication, improve the decision-making process of what is the best for the patient. Brainstorming, treatment planning, risk assessment, decision-making process. Then the third moment is the moment of trying to convince the patient that we have the best strategy for them. So after we design a beautiful smile and we treatment plan a beautiful plan, now we need to take this project and present to the patient. So how we can use technology to engage with the patient, to generate motivation, and to have the patient understand that that is the best for them. And then after case acceptance, after presenting and selling the treatment, we need to then perform. Finally, we need to work as a dentist. So at the end, you will see that technology can also help us to create more efficiency on the process of treating our patients. So we're going to talk about that as well. I was introduced already, but quickly explaining that I went to dental school in São Paulo, Brazil, but I also went to dental technology, so I'm a dental technician as well. And actually, I'm more a technician than a dentist. I worked my whole life as a technician, even though I was a dentist. And by deciding on working as a technician, it gave me a special condition where I was able to travel around the world and work with great dentists as a technician. That gave me the opportunity, of course, to learn from many important people in the industry, but also, since I was a dentist as well, they would allow me to also work in the patient's mouth. So I was able to do the lab work and also test my work in the patient's mouth. And that really created a special learning experience and learning curve for me. So for 20 years, that was my work. I was in the lab as a classic, handmade, no digital at all, dental technician for more than 20 years. Fabricating wax-ups, ceramics, doing photography, and even working on the presentations, putting the presentations together to the dentists that I was working with as well. Before we start with the content, I want to suggest a special kind of mindset, as I'm going to be bringing new ideas. And I know that many of you are already experienced dentists, maybe, already successful, working and delivering great dentistry. So my suggestion is that even though you are an expert already in what you do, to give a chance to the information that I'm going to be bringing and try to open your mind and pretend you're just a beginner. And that is usually the best way for us to learn. Because when we think as an expert, we have little room for new information. But when we think as a beginner, even if we are great on what we do, but if we program our mind to think as a beginner, we always learn much more, and we are able to change and improve and adapt. So that's what I usually try. It doesn't matter the topic. When somebody's talking to me or showing something to me, I really try to look at things with beginner's eyes and mind. Another very important thing is to understand that the dental world is changing so fast at this moment. We are living a very special moment in dentistry. Technology is changing, the way we do things are changing, patients are changing, human behavior is changing, consumers are changing, companies are changing, the way we manage our business is changing. Everything is changing right now. So it's a very disruptive moment in dentistry. So we really need to be open to reinvent ourselves, to be able to be competitive, to be able to succeed on the next 5-10 years. And I usually say that it doesn't matter what brought us to this point successfully, this will not be enough to keep us successful in the next 5 to 10 years. Because many times I lecture to very successful dentists, and they see all these new ideas and they say, but Christian, this is a very nice idea, but why do I need to worry about this? I'm already successful. I have many clients, and my dental office is doing very well. And that's what I usually say. Nowadays, it's very dangerous to be stuck in your comfort zone, to be doing the same thing, because everything you did that made you successful till today will not be enough to keep you successful tomorrow. So it's an amazing time where I see younger dentists, even with less experience, starting to surpass, to succeed more than more experienced dentists, because the consumers are looking for a new experience, for new solutions. And usually the older, more experienced dentists are not open for these new solutions. So it's a moment where things are shifting, moving, and there's opportunities all over. And that's the reason why I believe this is the most exciting and beautiful moment ever in dentistry. But as I said, it's important to understand that the basics are still the same. Dentistry is still dentistry, and we can only take advantage of technology and marketing and new solutions if we have the basics under control. So that is a starting point for us. Digital helps us with better processes, but analog knowledge and know-how is key to know what we what to do with this technology. Another very important topic that I'm sure it's obvious for everybody, but I always like to emphasize, because as we are bringing new solutions, new exciting solutions, new exciting marketing solutions, it's very important to understand that the better we get as communicators, the more we understand how to convince people to do what we want them to do, the bigger our responsibility. So above anything, above our success, above our own interest, is the interest of the patient, of course. And to understand how to balance all these exciting solutions with what is the best for the patient, we need to have a very strong ethical behavior. I want to start asking 2 questions to you. Is the translation good? The speed good? Everybody can understand? Yes? So, the first question is, are we ready for the future? Are you ready for the future? Now, to understand how to answer this question, you need 2 things. First, you need to understand exactly where you want to be in the future. Otherwise, you cannot understand if you're ready to get there. You need to understand where do you want to be, and then you need to understand the trends, so you can plan your path, your strategy to get where you want to be. So I usually suggest that we should have very clear in our mind where we want to be in 5 years. And this is a very important exercise, to really be able to close your eyes and see yourself in 5 years. But really be able to mentalize in details you in 5 years. Where do you want to be? What kind of dentistry you want to be doing? What kind of patients you want to be treating? What kind of office you want to be working? Do you want to have a big office, small office, high quality, low quality, more people, less people, partners, no partners, associates? Really understand the model that will make us happy. Understand of the type of clients that will make us happy. The personality of people that fit our style. The kind of dental problems that are comfortable for us to treat. Because as we mentalize our future, the chances of getting there are much more bigger. So we need to plan our career. We need to understand the trends, and we need to understand the options. And preferably, to succeed in a competitive market, and I'm sure here in Taipei, there's also big competition with many dentists providing good services, we need to try to be one step ahead, to be the first mover, to take advantage of being the first mover if we know which trends the consumers will value. And there's 2 magic words for me nowadays, 2 words that I like the most to talk about today. One is efficiency, and the second is differentiation. So for me, in the near future, every successful dental office will have to focus on these 2 things. How to do things that every dentist does, but with more efficiency. quality with efficiency. And second, how to look different in the eyes of our consumer. Differentiation. How to be different. How to be special. So the question is, what makes you special in the eyes of your clients? If I would go to your office and ask your clients, why are you here? Why did you choose this dentist, not the other one down the road? Why? What makes him special for you? This is a research that we need to make, because we need to become experts on what made that person come to us. Because only by understanding the process of decision making is that we can multiply that. We can understand what are the things that we are doing right and what are the things that we are doing wrong when it comes to convincing people. So, just for me to have an idea, how many people here own their own dental office? If you can raise your hand. Okay. And from the ones that don't own your office, how many here would like to own their own dental office? Or are planning to own? Nobody. So everybody else is very happy working for somebody else. That's okay. There's no problem on that. Okay, maybe your boss is here, so you don't want to raise your hand. Okay, I got it. You can tell me in the break. I'm not going to tell anybody. Okay. So it's really important, and you're going to see that the day today is not only about dentistry, it's about really how to create strategies as a dental office owner. Okay? That's the key. So we know that we need to constantly be reinventing ourselves, because things are changing, consumers are changing, companies are changing. And if we don't change, the other dentists down the road will change. And maybe they will become special more than us in the eyes of their consumers. So as we know, the worst place to be nowadays is inside the comfort zone. Regardless the stage of your career, staying at the comfort zone, it's pretty dangerous. Now maybe it's the resolution here. Huh? The connection there, it's moving maybe? Yeah. Or no, resolution is low. Okay. So since I would say 7 years ago, I started to learn that there's much more involved in a successful career than just being a great dentist. 7 years ago, I started to realize, around 10 years ago, I started to realize that the most successful dentists that I knew were not necessarily the best dentists that I knew. And that intrigued me, because I was working with some of the best clinicians in the world, but I started to realize that every city I would go, there was always the best clinicians and then the most successful dentists. And they were two different people. And I thought that that was not fair, because I wanted my clinicians, my dentists, to deserve, because they deserve to be more successful. And I started to try to learn what the successful people were doing apart from being a great clinician. And I started then to not only spend time in dental meetings, but also to spend time with successful business people, successful communicators, successful marketing people, successful innovators, trendsetters, and I started to learn a whole new world. And I realized that there was a lot of things that I could learn from them and bring to my dentists, to my clinicians, to help them get the credits that they deserved for delivering great dentistry, for being so passionate about dentistry. I realized then the difference between real value and perceived value. Real value is the value that you know you deserve for all your effort, for everything you put into yourself, all the investments that you did to become a good clinician. That is the real value of you. The problem is that for the market, real value has no much value. Because it doesn't matter how much your value is. What matters is what others think your value is. What people think you deserve is not what you know you deserve, unfortunately. Because at the end of the day, people will have to choose you and pay you for a treatment. So I started to understand strategies to create perceived value based on the real value that I had. And of course, it's all about differentiation. It's becoming different in the eyes of the people, the community around you. Creating perceived value. Another thing that I learned from marketing people, they told me, you know, most of the dentists are competing for a small percentage of the community. Most of the dentists are treating 5 to 10% of the population only. The people that already know they need a dentist. Usually the people that are in pain or people that really are aesthetically driven. People that really want a better smile or they are in pain. These are the people that they walk into the dentist. And the dentist is not convincing them. They come already sold. They're just a matter of choosing which dentist they're going to pick. But this is only 10% of the population. 90% of the people out there, they don't know they need you. They have other priorities in life. They think that dentistry cannot help them. So if we understand that and we start to understand how to communicate with this big part of the population, we can start generating awareness and bring people and change their opinion about how dentistry can help them. Because smiling with a healthy mouth is one of the most important things in life. Being able to smile with confidence is one of the most important things in life. I'm not talking about perfect smiles. I'm talking about healthy, confident smiles. This is what we need to provide. Health and confidence. So everybody that is not smiling with a healthy mouth or not smiling with confidence, they don't know, but the dentist could be their best partner on changing that. So it's up to us to start to change the way people see dentistry, the way people perceive dentistry. Change the perception that dentistry is something bad, painful, waste of time, and a waste of money. That's how people look at us. They look at the dentist as a boring professional that takes their money, their time, and generates pain. So it's very hard to sell dentistry or to convince people to invest in dentistry because there's a very big negative marketing about what we do. We are the only crazy people that love dentistry. Normal people, and I call normal people non-dentists, they don't like what we do. So we need to change completely the way we explain our profession. We need to change completely the way we talk to people, not only in our offices, but in social events, in family meetings, at parties, in the bar, everywhere we go. We need to change the way people see our profession, because we deserve the value for that. And if we do so, we start to reach out to the big part of the population. And people will start understanding and falling in love with what we can do for them. Because everywhere in the world I go, I see people putting dentistry as a low priority. I usually say that we go to places and I see people with bad mouth driving fancy cars. And it doesn't make sense for me. Because rationally thinking, I prefer to ride a bike and have a great healthy smile. Because smiling with confidence is the shortcut for happiness and success. So we need to start sending this new message to everybody out there. So what is the message here? That you guys can go to the best congresses and courses all over the world and learn amazing things. And everything is very cool, but to create value, we need to know how to tell the story to the consumer. So I'm going to ask you a question now. Monday morning, you're going to be working in your office, you're going to be seeing a patient, right? Probably everybody's going to be seeing a patient on Monday. Yes? Does your patient know that you were here on Sunday? No. They have no clue. They will give no value for the fact that you're here today. How many dentists we have in Taipei or in Taiwan? Thousands, right? Most of them are at home, enjoying family and life, having fun. And you're here, right now. Are you here for you? Not actually. You're here for your clients. You're here trying to become a little bit better. You're here trying to find a better solution for them. You're here to try to provide a better service for them. But if you don't create a strategy to tell this story, nobody's going to give you the credits. Nobody's going to give you the value. So my question is, think about how Monday morning you can generate a story to make people value the fact that you invested your time and your money to be here today, not enjoying Sunday. You deserve that credit. Now, what I learned is that understanding how to tell great stories about the great things that you do is the shortcut to make people value your effort. Otherwise, they will take it for granted. And they will think you're just normal like the others. So, for the last 5 years, I've been interacting with great communicators, and I understood the power of these two things. Knowing how to tell stories, and there's a very simple, technical way of becoming a great storyteller. For me, one of the biggest and most important skills on a successful person is communication skills. Great communicators have a much easier path to succeed in any area. We can educate better our kids if we know how to communicate. We can have a better relationship with our partner. We can have better conversations with our spouse. We can have a great conversation and get support and financing from our bank. We can handle issues much better. Everything becomes easier and better if we know how to communicate. Once I heard that more than 70% of all the conflicts in human history happen because of lack of communication skills. That means that more than 70% of every war that happened in our history could be solved with better communication. Communication, it's underrated. It's one of the most important skills. So as dentists, our profession is directly related to good communication. So researching about storytelling techniques is an amazing thing. Knowing how to say the same thing in a different way to bring people to our side. Amazing. And then if we combine with another amazing thing, that means communicating with images. Instead of trying to explain a treatment plan with words, showing to your patient with images and 3D simulations exactly what is going to happen before it happens is one of the most important things to make people value what you do for them. Because it's very important for us to understand that when we are presenting a treatment plan, the patient has no clue, no idea what is going to happen. But the patient has to decide today and pay for the treatment before the treatment happens. What does that mean? It means that we are not selling the treatment because the treatment doesn't exist at that moment. We are selling the treatment presentation. Patients don't accept the treatment, they accept the treatment presentation. And I realized that as dentists, we can be great clinicians, but we don't practice how to become great presenters of our treatment. So practicing treatment presentation is an amazing investment in your career. So since the beginning of digital smile design, we've been trying to work on understanding the human brain and improving communication. So this slide that looks very confusing is actually the summary of the whole concept. Understanding that your client goes through a journey. From the moment your client hears about you the first time, maybe through a friend, word of mouth, that's when the journey starts. And sometimes your future client will hear about you, and then after 1 year, this same person will check your website. And then maybe this person will be exposed at your work on social media. And then maybe after a couple months, this person will decide that they need to go to a dentist. And then this person will look at the friend again and hear about you again. So multiple exposures to you until that person makes a decision to go to you. So your client goes through a process of first being aware of how dentistry can help them. Then they go to a phase of consideration. Do I really need to go to a dentist? Who should I go? Where do I put my money, my time, my efforts? Do I go in vacation? Do I buy a new car? Or do I invest in my smile? And then suddenly, this person decides, I need a dentist. And then this person comes to your office. So from a virtual experience, this person goes to a real experience. Driving to your office, parking, going through the problems of finding a place to park, walking into your office, or maybe calling the office, going through the phone experience with your secretary, then experiencing your front desk, your waiting room, right? And then finally getting to know the dentist going through a clinical exam. Emotionally, the patient is going through a journey. And everything is impacting this person emotionally. Even though the patient thinks that the decision of choosing a dentist is a rational decision, this decision is actually purely emotional. Because we are human beings, and human beings are emotional beings. So we make emotional decisions every day. So the decision of buying a new car or investing in their smile, it's not a rational decision. It's an emotional decision. So if it's an emotional decision, it's impacted by emotional little factors. So it's what we call the emotional game. In life, we go through an emotional game, and every little experience can add emotional credits or lose emotional credits. For example, I love music, and every place I walk in, if the music that is playing is bad, I want to leave. Now, this is not rational. This is unconscious. I'm going to walk into a physician office, into a doctor's office, and the music is bad. My brain is not rationally thinking, but at the end, I'm going to say no, thinking that was rational, but was not. Was an addition of little things that impacted my brain, my experience. And then rationally, I'm going to find an excuse to say, I don't want to go to this doctor anymore. So it's an emotional journey that the patient goes through from the moment he hears about you all the way to this moment here, when they say yes. Dentistry only starts here. This is dentistry. Right? Everything before here is what we can do to create value, to make people choose us. So from the virtual experience, the physical experience, a first appointment where you're going to do the exam, you're going to take photos, x-rays, you're going to document your patient. Then maybe you're going to tell your patient to come back in a few days. So you have a treatment plan ready to present to them. And then you're going to present this whole plan, and hopefully the patient will say yes. And if the patient says yes, then you become a dentist. Then you show them what you can do. You treat them. And after the treatment is mainly done, hopefully this patient will become a fan, will become a promoter. And as they become fans and promoters, they generate word of mouth, and they probably bring a new patient to you all the way here. And then this new patient will go through the whole experience again. So understanding this journey was very, very important for us. Now, for me, as a dental technician, so let's go back in time now, I realized that I wanted to be different. Why I wanted to be different? For a very simple reason. I wanted to charge more for my work. I wanted to work less and make more money. Who likes that? Is that okay for everybody? In Taiwan, people like to work less and have a better life as well, right? Nothing bad with that, right? We deserve that. So I realized that as a technician, there was a maximum I could charge. There was no way I could go over that. So I needed to reinvent my role in the team. I wanted to become a smile architect. I realized that I needed to give much more to my dentist than just crowns if I wanted to have more value in the team. So I started to try to really add value to my work by interacting and helping the dentist to succeed. The only way for me to charge more was to make my dentist make more money. And if he would become more successful, maybe he would give me a little bigger piece of the pie. So I started to understand the process of helping my dentist to succeed. As I mentioned, there was another great thing about being a technician and dentist, because I was able to suffer with my own mistakes Every mistake I would do in the lab, I was the one going to the mouth and trying the restorations myself. So I would suffer with my own mistakes. Because dentists would allow me to try in my own work because I was also a dentist. So many times I would go with my work to the office and I would be the one to remove the provisionals, to clean the preps, to try in the crowns, to adjust the fit, to check the gums, to screw the abutments, to fit the crown, to work with soft tissue manipulation, to condition the tissue, to adjust the bite, to check the aesthetics, show to the patient not happy, remove everything, go to the lab, fix again, place it in, until everything was perfect. And then the dentist would come in and bond. So everything, in the lab, the day before, if I was tired and I would say, you know what, I'm going to skip this step. I'm going to cheat a little bit here. I'm going to not do this perfect. I was the one suffering with this in the mouth. So I realized that in dentistry, we waste a lot of time in the patient's mouth fixing things that could be fixed outside the mouth. I also learned that everything we do in the mouth is our most precious time. It's our most expensive time. It's our chairside time. So I realized that everything I would do outside the mouth to save time in the mouth was worth doing it. Financially, technically, and emotionally. For my business, everything needed to be done better outside the mouth. So I started to realize that we didn't have an ideal workflow between documentation and lab work. How to transfer to the lab the information to improve the smile design process to reduce aesthetic adjustments in the mouth. How many restorative dentists we have here? Who works with restorations, smiles, ceramics, veneers, crowns? Do we have orthodontists here? Orthodontists? Implants. Who does implants? Okay, perfect. So we are all on the same business. We are on the smile business. We all deliver smiles. We all, of course, the smile needs to be healthy. We need to deliver function. We need to deliver biology. We need to deliver structure. But we also need to deliver aesthetics, right? Our patients, they want a better smile. So how much time do we all waste every year adjusting aesthetically the restorations coming from our labs? Who here ever had to adjust restorations because they were a little bit canted like this? Happens here in Taiwan as well? Only in Brazil. We try everything and then everything is a little bit off. Or the midline is canted like this. How many times the incisal edge is a little bit too long? Or a little bit too short? Right? Or the restorations are a little bit far out, or a little bit too in, or the buccal corridors are uneven, or the smile curve is not blending with the lip. All these aesthetic principles that we, every week, we need to spend time in the mouth adjusting them. That made me realize that in dentistry, we transform the patient's mouth into our laboratory. Why? Because we don't have a system that allows the technician to fix these mistakes before going to the mouth. So the patient's mouth is our laboratory. We test things in the patient's mouth, and that is not smart. And with all the technology that we have today, there's no reason for us to suffer like that. There's no reason. I'm not saying that we will eliminate occlusal adjustments. I'm not talking about occlusion here. I'm talking about aesthetics. I'm talking about the restorations in harmony with the face and the lips. I'm talking about trying restorations, telling the patient to look at themselves and the patient saying, wow, this is beautiful. This is exactly what I want. Imagine this happening every day, every time, without having to adjust things in the mouth. Isn't that a dream come true? This is amazing. And this is totally possible. But 10 years ago, when I started to think about that, I realized that we couldn't do the things the same way we learned. We need to think outside the box. Sometimes we do the same things for 40 years and we don't think. We do automatically the same thing over and over again. No, because my teacher told me that that's the way to do it. But I was always questioning these things, saying, why can we do it more efficiently? How can we be more efficient? If somebody told me that to do a single molar crown, it takes 3 hours and 2 appointments, and everybody's doing the same, I was thinking, if it takes 3 hours, can I do something that instead of 3, I can do in 2 hours and 55 minutes? What can I change to gain 5 minutes? Because if I do 1,000 crowns per year, you multiply by 5 minutes and you do the math. It's almost like a month of vacation just by improving a little step, a little process. And we can do that with everything we do because nobody in dentistry thinks like that much. So there's a lot of room for improvement. But we need to get away from our comfort zone. We need to think about it. So my experience as a technician made me think about it, because I didn't want to repeat my work. I wanted to be more efficient. So yes, we need to think about the 4 basic principles of dentistry. Clinically speaking, this is success. These 4 pillars, right? But I realized that we were wasting a lot of time on the aesthetic part, and that was the part that patients were valuing. Patients cannot understand osseointegration. They cannot understand how good is an endo treatment. Patients cannot understand the healing of a surgery. The only thing in dentistry that patients know is smile design. How my smile is fitting my face, how happy I am with my smile. So I realized that I needed to become a smile designer. So I started to read articles. And I realized that there was something called facially driven dentistry, facially driven smile design, facially driven treatment planning. And that was a great moment for me. I started to realize that few mentors were talking about a new way of treatment planning based on aesthetics, based on the face. We were doing dentistry like this, where we were fixing these problems. We were fixing function, structure, and biology the best way we could. And only at the end, we will try to think about aesthetics. And we realized that if we would put aesthetics first, it doesn't mean aesthetics is more important, because it's not. It means it's the starting point. Before we try to find the treatment plan solution, we try to visualize exactly where we want to be at the end. So we start from outside in. It's what some people call reverse treatment planning. You start from the end and you work backwards towards the solution to try to see if it's possible to achieve that result. So when we moved into this type of dentistry, everything made more sense. Facially driven dentistry. In that moment was the first moment that I realized I was becoming a real architect of the smile. Because architects, they first design the house from the aesthetic standpoint. And afterwards, they're going to try to find an engineering solution to make that beautiful project possible. And only after that, they're going to build the house. In dentistry, we invert this. We start building the house. As we are building, we try to treatment plan. And then after treatment planning, we see how beautiful the house will be. It doesn't make sense. So I started to tell my clients that I needed to become their smile designer. So what I started to do was to call my dentist and say, look, every new patient that walks into your office, before you treatment plan, before you start treating, make me some facial pictures, send it to me. And the dentist would say, but Christian, I don't even know if the patient will accept the treatment. I would say, no worries, just send me the facial pictures, allow me to work on these pictures and draw some lines to help you plan the case. And then the dentist would say, but Christian, I don't know if the patient decides doing it, I don't know if I'm going to use you as a ceramist at the end. I said, no worries, just send me the picture, no commitment. I want to work on this project to help you so you can plan better your case. And if the patient accepts, we can do the case together at the end. So I started with these facial pictures, and 10 years ago, very few dentists were working with facial pictures. It looks amazing to think about that. But we would not get facial pictures. And I would ask myself, how can I design a smile for somebody if I don't see their faces? And this is what every technician was doing all over the world. Designing smiles blindfolded. Not seeing anything. Guessing completely. So that was my facial journey. I started by drawing these drawings, and then I would send back these drawings to the dentist. Say, look, I hope that these drawings can help you see better, plan better, communicate better, and even explain better to your patient. And then dentists started to use these drawings, and things started to get better. They started to call me back and say, Christian, with these lines, I can see better what is right, what is wrong, and I can plan better. Even better, I can share these drawings with my orthodontist, with my periodontist, with my implantologist, and everybody's looking at the same vision, at the same goal. So we are making combined decisions. Very good. And even better, I'm showing these drawings to the patient, and patients are visually understanding the treatment. For the first time, the patient is actually understanding where we want to go. And this is helping the patients to say yes. So this became part of my work, became like my package of differentiation. And dentists would send pictures to me just to do this. Sometimes I was not even the ceramist. I was just doing the smile design project for them. Of course, at the beginning, I was working with hand drawings. I was doing drawings with my hands and sending them. So this was going back to them with my wax up. My wax up was not just a wax up. I would give them a wax up, all the drawings, and the report where I would write all my insights about everything that I saw as I was waxing. And that became a product itself. And then after hand drawings in 2004-05, I moved into PowerPoint. And I started to use PowerPoint instead of drawing with my own hands. And that made things easier. And then, of course, afterwards, we went into dental softwares, and we started to use specific softwares. And nowadays, we use our application that we can do this in 3, 4, 5 minutes, right in front of the patient. And we can have what we call the smile frame, the starting point. We don't know if this is possible. We don't know how to get there yet. We start from here, and then we sit with the team and we treatment plan to see if that is possible. So the smile frame is a process that I started to do in every case that I was getting. Another very important part of the smile frame was that I was always designing my cases looking at videos. I was never based only on photography, because I learned that beautiful smiles are beautiful when things are moving. People don't want to look beautiful on the photo only. They want to look beautiful in real life. And when you look into videos, you change your perception of the smile. Sometimes when we look at photos, we think that certain things are right, other things are wrong. This we need to change, this is okay. But when we look at videos, we change our mind. Some things that look bad in the photo don't look bad on the video. So why change? Would I follow the photo or the video? Of course, the video. So video recording became mandatory for us, for every smile design patient. We don't create treatment plans without looking at the videos. And that really improved the process a lot. And by looking at the videos, we can have a perception, a better perception of where should we put the midline, where do we put the incisal edges, where do we put the distribution of the 6 anteriors, what is the best proportion of the central for that face, where the gum line should be, where the pupillas should be. And then we can have a starting point of where we are and where we want to be. From the top picture, looking from the top of the head, we can have a very important perception of volumes, of where we are and where we want to be. And from the occlusal as well. And then the same thing from the profile. So this is what we call the 4 views of DSD. 4 simple photos that allows us to design smiles according to faces. So I started to try to learn how to place these lines. I started to become a real smile architect. And again, the thinking process here is very simple. We don't treatment plan cases before we have a clear vision of what is the best design for that smile. We don't jump into conclusions. When we look at the patient and we say, this patient needs ortho, instead of saying that, we stop. With our experience, we look at the smile and we have the temptation of jumping into conclusions. We don't do that anymore because we don't want to have risks. We want to create a standard, a workflow, a process that we repeat over and over and over. So what is the first step? We document the case. We analyze the face. We trace the lines. We understand what is ideal with that face. And then we go backwards and we analyze where we are and where we want to be. And then maybe it becomes more clear. Do we need ortho? Yes or no? How much ortho? Where do we want to move the teeth to make that project happen? Do we need only ortho, or is it ortho plus restorations? Or maybe can we avoid ortho only doing restorations? Or maybe can we do ortho and open the bite? Or if we open the bite, maybe we don't need ortho. Or we need ortho and opening the bite and restorations. Do we need to align the teeth and do gingivoplasty to align the gum? Or can we align the teeth and align the gum and avoid a perio procedure? All these questions are impossible to answer if we don't have technology helping us to draw lines and simulate the procedures. So with digital, we can treat the patient on the computer before even touching the patient. We can simulate every idea, any possibility. We can see the combination of procedures. It's not only about having a software that simulates tooth movement. I need a software that I can simulate tooth movement, simulate crown lengthening, simulate bite opening, simulate the implant, simulate the surgery, simulate the restorations all together. Because I want to see the impact of one decision impacting the other. And a treatment is the combination of procedures. So the message here is always start from the face, never treatment plan before having a design project. Every patient deserves that. So at the beginning, everything was 2D. That was the only thing we had. So I was doing drawings, and then I would use these drawings to communicate with the prosthodontist and the orthodontist to see if that was possible. How much time of treatment, which techniques we would use to make that happen. And then after the procedure, I would use the drawings to quality control the procedure. So every professional would do their part, and in between each procedure, new pictures would come to me, and I would copy and paste the drawings to see if the procedure followed the project. So it didn't matter what the orthodontist said. I wanted to check the post-ortho to my drawings, and then communicate back to the orthodontist and show, look, you're not done. You need a little bit more. We are not there yet. Or maybe consciously live with the compromise and say, okay, let's stop here. It's not perfect, but it's good enough. But we needed to be conscious about each one of the steps of the treatment. And that changed the quality of our results, because everything was guided. Everything was controlled. And we knew where we wanted to be. So this is what I call guided dentistry. Guided dentistry is not only guided implant. Every procedure is following the plan. So guided dentistry means that we need to have a team that respects the project and is willing to use guides to perform every single procedure in the mouth. So in the near future for us, dentistry will be fully guided, meaning that there will not exist freehand procedures in the mouth anymore. Every single little thing we're going to do, we're going to have a guide to be able to protect the project, make people follow the project. Why? Because that's the story that we're going to sell to the patient. The patient will require this. It's going to be mandatory for them. They will look for doctors that do that because they will feel safer. They will prefer to do a surgery with the dentist that is using a guide than to do a surgery with the dentist that they need to rely on their artistic skills, rely on their mood that day with the freehand procedure. So it makes sense to the patient. And that's very important for us to understand, that nowadays patients will demand certain things, because modern patients are different than old patients. In the past, people wouldn't ask questions. They would just open their mouth and the dentist will do whatever. Today, modern people are researching, are comparing, are questioning. They learn before they choose. So I realized that there was 3 concepts in dentistry that need improvement. These 3 concepts are very well known. Everybody talks about it: aesthetic dentistry, interdisciplinary dentistry, and emotional dentistry. Now, in my opinion, these concepts, we think we have them under control, but we don't. Let me share with you. Aesthetic dentistry. Everybody talks about aesthetic dentistry. Everybody teaches aesthetic dentistry. Everybody says that does aesthetic dentistry. Now my question is, do you think aesthetic dentistry is under control? In general, do you think we as dentists, as a profession, we know what we are doing when it comes to aesthetic dentistry? My opinion is no. There's a lot to be developed. There's a lot to be learned. And I want to prove that. Most of the smiles created by dentists all over the world are not natural. And in my opinion, we as dentists, we are losing the perception of natural beauty. Look at these two ladies. Two beautiful ladies with beautiful smiles. Which one has a prosthesis? Pretty obvious, right? It's pretty obvious that this lady has a prosthesis and this one has natural teeth. So we can see that. Now, for me, when we look at a smile like this, let's say this patient is not happy with her smile, so she wants improvement. We probably agree that maybe we can do some alignment, right? Maybe we can bleach a little bit. Maybe we can change her old composites. Maybe we can do a little bit of gingivoplasty to level the gums, to make it nicer. And she will probably, with a simple treatment, become even more beautiful, with an even better smile, right? And she will get probably what we call an organic smile, a natural smile with natural, beautiful imperfections. As we say, nature creates perfect imperfections, and that is why it looks so natural. And this is what we call a synthetic smile, very symmetric, creating a perfect, unnatural look. So if I get the smiles and I outline the smiles, we can see here how we can make it better, right? And here what you see is same teeth with a little bit of improvement. So this is a better version of that. This is probably where we want to be at the end of the treatment. Now let's imagine this. If this lady has a car accident and she loses all her front teeth and she goes to a good dentist to make a bridge for her, do you think she's going to get a bridge that looks more like this or more like that? Probably, if she goes to a dentist, she's probably going to get something more like this. Why? Because we actually are not experts on natural aesthetics. So we need to understand that there's so much to evolve, so much to learn when it comes to giving to people natural, beautiful smiles. And this is an outdoor that I saw recently in Brazil that I loved. Why? Because I have here 4 models. And this in Brazil and in US, and now starting even in Europe, is very rare to see a celebrity or a model with natural teeth. Everybody's like putting veneers all over. Or very symmetric, synthetic, artificial look, right? And here, I fell in love with this because you see a lot of imperfections and they look beautiful. We have worn dentition, open embrasures, uneven centrals, crooked laterals, and I just love it. Now, if they go to a dentist, probably the dentist will try to fix and then we'll give them an artificial look. The problem is that we are so used to artificial that we are starting to believe that artificial is more beautiful than natural. And that's a problem. And that's of course something that started in the Western world. I don't know how this is affecting over here. But hopefully you guys will make the movement to start to respect again nature. Give value to natural look. Now, are dentists here in Taiwan using Facebook a lot? Here Facebook is not like in China, there is no Facebook. Here you have Facebook, right? You have Facebook here? Yeah. So, dentistry is huge on Facebook all over the world. I don't know why, but we as dentists, we took over Facebook. Facebook became the biggest forum for dentists all over the world. Great. Amazing discussions, sharing, opinions, fights, like, don't like, cases, whatever. But the thing is that on Facebook nowadays, I'm seeing things that are really worrying me. I see things like this, and good dentists, very good dentists posting this, proud. And I'm looking at this and saying, this doesn't exist in nature. God never made this. So this is something different. Why do we appreciate this? Why are we changing nature if nature is so beautiful? And more, our human eyes are trained to fall in love with nature. And why we are going against this, right? I see things like this where this shape and this texture doesn't exist. We humans, we invented this with our own hands. And then we do this so much that we start to think that this is the way to go, that this is beautiful. And it's not. Or we see things like this. Many times the before for me is more beautiful than the after. I see that a lot. I look at the before and say, wow, this is beautiful teeth. And I cannot imagine that somebody took a burr and destroyed this beautiful teeth to make something synthetic, not organic, not natural, not beautiful. So I'm not criticizing the dentist that did this. Actually, by the way, I know the dentists who did these, and they are great dentists. Imagine the bad dentists. It's just that we need to be aware that something is going on and we are missing the contact with nature. There's a friend of mine, very good dentist from Abu Dhabi, and he said something very nice. Dentistry is heading towards a dark era. Millions of disease-free procedures under the name of cosmetic dentistry. Now, that's why I always say, we all want to have a nice smile. But nice smile doesn't mean a natural smile. That's why I love this. I never talk to patients about the perfect smile. I always talk about the confident smile. And when we talk about confident smile, everything changes. The whole perception, the whole conversation, the value of dentistry changes. Because when I look at my patient and I say, look, I'm going to make your smile perfect. In my humble opinion, we are diminishing the value of our profession. Our profession is so beautiful, so profound, so holistic, so comprehensive, so impactful, so life-changing. We can change people's life every single day. That when we talk about perfect smile, we are making our profession shallow as a cosmetic procedure. So I never talk about perfect smiles. I talk about health and confidence. you, my patient, I can help you. I can improve your health, and I can give you back your confidence. Because you probably agree with me that if I have a patient that is healthy, and the smile is not beautiful, but healthy, but the person is already smiling with confidence. Even though the smile is not perfect, that person is already smiling with confidence. Do you agree that there's no reason to change their smile? If they're healthy and confident, why I'm going to change somebody's smile? So we need to talk to our patients about how we can improve their confidence by improving their smile. Because that's amazing. That is great. That is profound. Because many people are not smiling with confidence. And this is something important for us to understand, that when we don't smile with confidence, many things in our body will not happen. It's proven by science. And this is a very nice video that you can look on YouTube. Amazing researcher talking about the power of smiling with confidence. What does that mean? One of the findings of this research shows that when we smile with confidence, and we should all smile with confidence 30, 40 times a day, without putting our hands, without holding our lips, without turning our head, smiling full power, with freedom, with confidence. When we smile like that, we generate reactions in our body. It's not only psychological, it's physical. When we smile, there are hormones and reactions in our body that becomes one of the most powerful medicines. Smiling with confidence is compared to a great diet and sleeping very well. You sleep very well, you eat well, and you smile with confidence. 3 things that can cure any disease. And smiling is that powerful. Now, look how interesting they found out that when we fake a smile, meaning we don't smile for real, we pretend we are smiling, the same reactions don't happen. How interesting is that? That means that every person that is holding back their smile has a bigger chance of getting sick, living less. These people will be perceived as less successful, will have less friends, will have a worse life. So if you don't smile with confidence, your dentist is your best friend to change that. That's how profound what we do is. And that's why we need to give back confidence to people. So that's aesthetics. So what is my message here? We all need to understand our limitations, understand that this is just the beginning of the journey, not the end. And we really need to improve our skills on delivering back natural beauty. Another topic that is very well known, interdisciplinary dentistry. We all know that today dentistry is not anymore fragmented. We cannot anymore treat our patients by ourselves if we want ideal treatments, if we want comprehensive solutions. Dentistry is a combination of specialties, and we all need to work together to find out the best plan for our patient. It's obvious, I believe, for everybody that modern dentistry is interdisciplinary dentistry. Everybody agrees? If you go to a dentist, do you prefer to go to a dentist that only looks at one detail, or you want to go to a dentist that has a comprehensive vision of everything and will give you a comprehensive report of everything that can be improved? It's like when we go to a physician. If I have a pain right here, and I go to the doctor, I don't want this doctor just to look here. And I don't want this doctor to give me a pill to stop the pain right here. I want this doctor to look at this and look at all the connections with everything and understand absolutely everything that can happen because of this and give me a comprehensive treatment. So in dentistry is the same. We need to become comprehensive health providers. We need to become holistic. We need to become interdisciplinary. We don't need to know everything. We can be specialists on one thing, but our initial vision needs to be broad. And this is something that for me is also just starting in dentistry. So there's a lot of room for improvement. Interdisciplinary dentistry, first thing that we need to understand is the definition of interdisciplinary dentistry. What is interdisciplinary dentistry? Do we really provide interdisciplinary dentistry for every patient that walks into our office? Interdisciplinary dentistry for me, the definition for me is solutions developed by a team. And most of the dentists are delivering solutions developed by one brain. The patient walks into our office, we look at the problems, and according to our perspective, we deliver a plan. Now, it doesn't matter if you have a very interdisciplinary knowledge. It's still not interdisciplinary because it's still one brain making a decision. So we need to understand how to deliver interdisciplinary solutions for real. Meaning that every patient that walks into our office, the documentation of that case needs to be shared with the team, and the team needs to discuss what is the best thing to do. And the only way to do that is through technology. Because through technology we can create a system of communication that allows us to do this for every patient. Why dentistry is not providing interdisciplinary solutions today? Because we don't want? Because we don't know it's the best? We want and we know it's the best, but we still don't provide people with interdisciplinary solutions. Why? Because the biggest enemy of interdisciplinary planning is one, and that is lack of time. We don't have the time to stop for every new patient and go talk to everybody involved on the team. So at the end, we have to rush, we have to decide by ourselves, and we offer the solution to our patient. So what we need is to find a way to speed up the communication process. To allow a new patient to come, we document, we share in the cloud, it goes down to the pockets of all our team members, and then we can start doing what we call asynchronous communication. What means asynchronous communication? Means that we can communicate without being on the same place, neither available at the same time. Because the problem is that when I have 5-10 minutes free, the other person doesn't have the same 5-10 minutes free at the same time. That's the problem of the modern world. And we need to see 10-20 new patients per month. How can we do that? So we need a system of communication that allows us to communicate without having to pick a phone, without having to drive to the other person. I remember my father, dentist as well, going to the orthodontist once in a while with 2-3 articulators in the box, driving to meet, to discuss the cases. Can we do that for every patient? Impossible. Financially, it's not possible. Life goes on. So my father would have 3 lucky patients in the whole month that had the feedback from the orthodontist. All the others didn't have that benefit. We missed the opportunity. So every single day, we miss the opportunity of delivering better plans to our patients because of lack of time to interact with the specialists. And our treatment will be only as good as the plan. You're going to deliver an average plan and then think that the treatment is going to be amazing. No. It's like building a house. The blueprint needs to be ideal. So we need to understand that digital interdisciplinary dentistry is better for the patient. And the ones that will deliver that will create value. Patients will start to fall in love with that possibility. Right? We also need to understand that we need to close some gaps. That we have a gap that is not good for the patient. First gap is in between dentistry and plastic surgery. For some reason, there's very, very little interaction between these two worlds. Even though facial plastic surgery and smile design are working on the same environment. So we should never create a plan without understanding the connection between these two worlds. And inside dentistry, we need to close another gap. And that is the gap between the perioprostal world and the ortho-orthognathic world. There's a gap here. We don't communicate ideally. They don't come to our meetings. We don't go to their meetings. We don't know their main opinion leaders. They don't know ours. There's two different worlds. It's like if there were two different professions. And I don't understand why as well. Because the human being is one. The person is one. The client is one. They deserve to have this integration, this communication. So as a team, we need to go beyond the mouth. We need to understand the whole orofacial environment. We need to create orofacial plans and deliver orofacial treatment. So look at all the pieces here that we should understand when we provide a smile design project. The smile design project should incorporate principles of all these areas. And it's very interesting to understand that usually according to our specialty, according to what we like to do the most, when a patient walks into our office for a first appointment, we have the tendency to see only that thing. If we like to do veneers, we have the tendency to try to fix the problem with veneers. If we like orthodontics, we tend to offer orthodontics as a solution. Now, if a patient, the same patient, knocks in an orthodontist door, in a periodontist door, in a restorative dentist door, the same patient with the same problems will get 3 different plans according to each one's specialty. Isn't something wrong? The same human being, the same problems. That means that for me, something that needs to change in dentistry is the way we approach the patient on the first appointment. The way we diagnose the problems. The first professional to interact with the patient needs to be not a specialist, needs to be a holistic diagnostician. A general holistic diagnostician. Somebody that is not necessarily very good in one thing, but has a broad vision of everything. This is the person that needs to interact first with the patient. To have the vision, create the report, and this person needs to be the one to activate the specialists afterwards. So we need to learn from each other here. Because when I do an interview with the patient on the first appointment, when I'm doing the questionnaire, when I'm evaluating the problems, when I'm doing the clinical exam, I need to understand a little bit of all these issues. Look at this. Sleep disorders, TMJ, plastic surgery, screening of the tissues, dermatology, posture, Posture connected to the bite. We work with the bite. We don't understand posture. And people that work with posture don't understand the bite. And one thing is completely connected to the other. That means what? A lot of room for improvement. And the people that are improving are becoming different. And the patients are giving value to that. So what does this mean? All these limitations that I'm talking about, they mean one thing: opportunity. Opportunities to become different in the eyes of the clients. Because when I talk about these things to non-dentists, they understand. They want this. It's a very interesting experience. I suggest you to do that one day. To talk about dentistry. Give a lecture to non-dentists. Invite all your clients one day. Make a happy hour. Make a nice event. Talk about new concepts of dentistry. Invite your friends, family members, patients, possible patients. Have everybody sitting and give them a 1-hour lecture about all the new trends and possibilities. You will see what makes sense in their mind. And if it makes sense in their mind, you need to deliver, because they are the ones pushing the market. When I say something here in this lecture, it's not a matter of you agreeing with me. It's a matter of you thinking like a possible client. And if you think like a client, if my story makes sense to them, they will knock your door asking for it. And if you don't deliver, they will look for somebody else. So it's about them, not about us. So another opportunity comes for dentists that understands the face. Because we need to deliver treatments that are in harmony with the face. And most of the dentists don't understand much about the face. So huge opportunity. Now, if I talk to a patient and I tell the patient, there's 2 types of dentists. They're both very good dentists. But one understands the face, the other doesn't. Where do you want to go? Right? Obvious. So they will ask for it. Then you tell the patient, there's 2 dentists. One is a great specialist. The other one understands the whole thing. And if he needs, he asks for the specialist. Which one you want to go first? Oh, we want to go to this one first. So you see how obvious these things are? And then, well, this dental office is only one single dentist here. This one, he works integrated with orthopedists, chiropractors, with sleep disorder techniques, with posture, with dermatology. They understand about plastic surgery, orthodontic surgery, facial analysis, everything. Even if I don't need all of this, even if I'm a patient and I just need a simple fix on my molar, I prefer to go here because I feel protected. Human beings are like this. I don't need it, but I prefer this, so I go there. So think about what makes sense to the patient, not only to you, but to the final consumer. So the face is another environment. We do dentistry like this. How many times I treatment planned cases with my orthodontist only looking at models and x-rays? Does that make sense? It doesn't. How can you treatment plan orthodontics without the face? And the orthodontist is looking at the models. You know, I go to the orthodontist, I give the models, and I ask, what would you do here? And the worst thing is that he gives me an answer. He looks and now I would extract the premolars, do this, class 1, beautiful. And I'm like, how can he say a word without looking at the face? He should give the models back to me and say, Christian, I have no idea what to do. I don't know the patient. I didn't see the face. I don't know what is the smile design project. Where you want to end. If you show me the face and where you want to end, and then you ask me, what do you want to do with ortho? Then I can tell you. But we treat like this, right? And finally, the third concept, emotional dentistry, meaning the link, the emotional link with the patient, creating value towards the patient. What I learned, as I mentioned, is that we dentists, we are trained to do great dentistry. We are not trained to communicate with patients. And that's a big problem. I used to work with many dentists, so I used to enjoy sitting on the corner and watching the dentist communicate with the patient. I always liked to evaluate the human behavior and see communication skills. And I could see some dentists were good, some dentists were not good. I used to love to see the dentist managing the patient's emotions, expectations. When things were going wrong, how the dentist was handling that moment. When the patient was stressed, when the patient was angry. Some dentists could come around and bring the patient back. Some dentists couldn't. I could see the exact moment where the dentist lost the patient. I would say to myself, this patient is not coming back. He just got so angry and the dentist didn't use the right words. This patient is gone. And how many times our patients don't come back and we don't even realize. We meet them after 5 years and we realize, oh, you didn't come back. What happened? Something emotionally happened. And they decided to go somewhere else. So I realized there was a whole new world to be explored in terms of how to create relationships, how to create an experience, how to create differentiation. Look how interesting it is. Important research saying that 2% of the dentists in the world will become very good. Only 2%, masters. 8% will become good as well. So we have 10% of the population of dentists that are very, very good. 36% of the dentists will try hard to become good, but will never become that good. 54% of the dentists don't even care about becoming good. 54. Look at this other research. This other research says that from every 100 professionals, usually 10% of the top will make a lot of money. 90% will struggle their whole career. These are real numbers, okay? Meaning that from every 10 students in dental school, 1 is going to really succeed financially, 9 will struggle. Now put one research besides the other. What do you see? 10% of the dentists will become very good. And 10% coincidence, 10% of the dentists will make great money. What is the conclusion? %10 will become very good, and 10% will make a lot of money. So what is the conclusion? You need to become very good, and then you're going to make a lot of money, right? Wrong. Wrong. Why? Because I know people here, a lot of people here that don't care about being good. Where? At the top there, making a lot of money. I don't know here in Taiwan, but I ask this question all over the world. Do you know a dentist that is worse than you, but makes more money than you? Everybody knows that. And we are usually pissed at them, right? The same all over here. I'm happy to hear that. The same is what I say. The more I travel, the more I see how small the world is. Same things all over. Now we know that person, right? That person that is not as good as you, doesn't invest like you, doesn't care about the details like you, doesn't read the articles, doesn't go to the congresses like you, doesn't use a great technician like you, and the guy makes more money than you. And we are pissed. That's not fair. Right? The guy has a better car. His wife is more good looking. And we are pissed. At one point in my career, I decided to stop being angry at them and go to them and say, what is going on? What are these guys doing to be there at the top? Because I want to learn from them. I want to go back here and teach my great clinicians because they deserve. So one of the main reasons why I started with the DSD concept and with this whole research about human behavior and decision-making process, the main reason was actually two reasons. First, help my great clinicians to get what they deserve. Second, save the patients from bad dentists. Because the bad dentists, good talkers, were taking patients, convincing, motivating, engaging, creating perceived value. And I wanted these patients to see the value on the great clinicians. But the great clinicians were so worried about dentistry only that they didn't have the time to actually understand how to create value. So that was one of our missions. Save the patients from the good talkers, bad clinicians, and bring them to the good clinicians that were not as good. Marketing. So unfortunately, I wish we didn't have to worry about this. I wish life was easier, that we could just worry about doing dentistry, relaxing, but unfortunately the world is not like that. People are making decisions, and modern clients, and all of you will start to treat a certain type of human beings that they call millennials. You know the millennials? Everybody that is from 25 to 35 years old, they call the millennials. The new generation, right? This new generation has a specific way to behave, to decide, to be happy. And not only the millennials, but we in general today, we don't want just a great dental treatment. We want a great experience. Human beings, they want unique experiences. That's what we want. When we go to a great hotel, do we want just a bed and a shower or a great experience? When we go to a great restaurant, the same. When we walk into Apple Store, you have Apple Store here? Apple Store. It's an experience, right? They know how to make that happen. I saw here, you have Starbucks as well, right? Starbucks took over the whole world selling coffee. Why? They charge 3 times more than everybody else, and we all go there. It's amazing. 15 years ago, nobody could believe that Starbucks would take over. Why? Because many places were giving coffee for free. In US, you would put gasoline on your car and get free coffee. And then Starbucks opens across the street with the coffee similar quality. And we say no for the free coffee, and we go walk the street and we buy expensive coffee from Starbucks. Why? The experience. Somehow they understood how to create an experience, transform the moment of drinking coffee into a cool experience. And then people go. So why we all look for experiences? Because we modern people, we are spoiled. You know the word spoiled? We are used to great things, cool things. Everything needs to be cool. We are spoiled. Who spoiled us? They. All these companies, they spoiled us. Today, we want to have whatever we want, whenever we want, exactly the way we want. You agree? If I like banana, I want to eat banana every day of the year. I don't care if it's season of banana, no season of banana. I want banana every day. Now think about this. 100 years ago, even the most rich people in the world didn't have everything they wanted. Not even the king or the queen of England. 100 years ago, she didn't have air conditioner. Can you imagine that? No air conditioner. Human beings were used to suffer. If it's hot, it's hot. If it's cold, it's cold. If it's banana season, I eat banana. If it's no banana season, I don't eat banana. And I get used to it. The modern world made us spoiled. Everything needs to be the way we want. Great experience. And then these companies understood that, and they create amazing experiences. You fly Emirates. When you fly Emirates, you feel like a king. Even if you fly economy, they treat you like a king. You want to fly again. If you fly once in business class, it's hard to go back to economy, right? You suffer. The experience, once you live, you don't want to go back. What does that mean? That these people, your clients, are going to these places, having great experiences, and then they walk into the dentist, and there's no experience whatsoever. Why? Oh, my dentist is only focused on doing great dentistry. There's no experience. So the few dentists that understand that, they are creating an experience. People will never go back to the other dentist. Even if the other dentist is much better than the one giving the experience, patients will stay with the one creating the experience. Caring about the emotional impact journey of our clients. Understanding what makes the patient fall in love with the experience and what makes the patient not fall in love with the experience. So let's learn from the good examples. I believe that every clinic owner should understand, for example, how to become a Michelin restaurant. Just Google it. Google Michelin restaurant. You're going to see a list of things. It's perfect to bring the concept to dentistry. Every dental office should follow the same rules to create an experience. To get 3 stars Michelin, the food is part of the process, but it's not everything. Right? Same thing with 5-star hotels. Imagine if your dental office